Florida's beaches with their sun-kissed sands and inviting waters are a beloved escape for millions. They represent relaxation, recreation, and the quintessential vacation experience. But beneath the surface, a hidden danger is making waves. A threat far more insidious than sunburn or jellyfish stings: flesh-eating bacteria. This microscopic menace lurks unseen, posing a serious risk to unsuspecting beachgoers. This year, we're witnessing a concerning surge in infections, a spike that has health officials scrambling to understand the underlying causes and implement effective preventative measures. Tragically, this increase has led to devastating consequences, with several reported deaths casting a shadow over what should be a time of leisure and enjoyment. These losses serve as a stark reminder of the severity of the situation. What was once considered a rare threat is now rapidly evolving into a pressing public health concern, demanding immediate attention and a coordinated response from health organizations and the community alike. Families are understandably on edge, their carefree beach days now tinged with anxiety as they weigh the risks against the desire for summer fun. And health officials are working tirelessly, racing against the clock to understand the factors driving this alarming increase in cases and to develop strategies to mitigate the spread. They're delving deep into the data, seeking answers that can protect the public. The culprit, a bacterium, specifically Vibrio vulnificus, lurking in the warm, brackish waters of Florida's coastal areas. It thrives in these environments, posing a greater risk during the hotter months. This bacterium can infect swimmers through open wounds, cuts, or even small abrasions, turning a relaxing dip in the ocean into a potentially life-threatening situation. It also poses a risk to seafood lovers, particularly those who enjoy raw oysters, as the bacteria can be present in shellfish harvested from affected waters. These aren't isolated incidents confined to a single beach or region. They're part of a troubling trend observed across multiple coastal communities, indicating a broader environmental issue at play. This escalating situation is putting entire communities on alert, prompting local leaders and residents to take proactive measures to protect themselves and their loved ones. The Florida Department of Health is actively monitoring the situation and issuing frequent warnings to the public, urging caution, promoting awareness, and providing guidance on how to minimize the risk of infection. Understanding the science behind this bacterium, its transmission methods, and the associated risks is absolutely key to staying safe and making informed decisions about your health. In this video, we'll break down exactly what this bacterium is, exploring its characteristics and how it differs from other common microbes. We'll delve into how it infects the human body, examining the pathways it uses to enter and the mechanisms by which it causes illness. Furthermore, we'll explore the potential reasons why cases are rising, considering factors such as climate change, pollution, and other environmental influences. And most importantly, we'll provide you with practical, actionable steps you can take to protect yourself and your family from this potentially deadly bacterium. The goal here isn't to incite panic or fear, but rather to empower you with practical knowledge and the tools you need to make informed choices. With the right information and a healthy dose of caution, you can continue to enjoy the beauty and recreational opportunities that Florida has to offer, all while minimizing your risk of infection. So let's dive into the facts, separate the myths from the realities, and equip you with the steps you need to stay safe and healthy in the face of this growing threat. The term flesh-eating bacteria often evokes fear, but the actual culprit behind some of these infections is Vibrio vulnificus. This bacterium is a natural resident of warm, brackish coastal waters, thriving in the places where freshwater rivers meet the salty ocean. These are the kinds of environments where many marine organisms flourish. It's not a new threat, nor is it man-made. It's been a part of our ocean ecosystems for ages, playing a role in the complex web of marine life. It thrives particularly well in estuaries, those dynamic zones where rivers meet the sea, creating a unique mix of salinity and nutrients. Unlike some of its more infamous relatives, such as those that cause cholera, Vibrio vulnificus poses the greatest danger when it manages to enter the human body. This typically occurs through open wounds that come into contact with contaminated water, or by consuming raw or undercooked seafood, with oysters being a particularly common culprit. The bacteria tend to flourish during the warmer months of the year, especially from May to October, when people are more likely to be in the water and consuming seafood. This is because water temperatures rise, creating an ideal environment for the bacteria to multiply and thrive. Infection typically happens through two primary pathways. The first is through open cuts or wounds that are exposed to contaminated seawater or brackish water, allowing the bacteria to directly enter the bloodstream. The second is by eating raw or undercooked shellfish, particularly oysters, which can harbor high concentrations of the bacteria. Oysters, being filter feeders, naturally filter large volumes of water to obtain nutrients, and in the process, they can concentrate the bacteria present in the water within their tissues. It's important to remember that not every drop of ocean water is teeming with danger, but certain environmental conditions and recreational activities can significantly increase your risk of exposure. Individuals in good health with strong immune systems may never even experience symptoms, or might only develop mild illness, but those with weakened immune systems or underlying health conditions face a considerably higher threat of severe illness and complications. Understanding where Vibrio vulnificus thrives and the ways in which it can infect humans is the crucial first step towards effective prevention. Being aware of your own health status, potential risk factors, and the activities you engage in is absolutely crucial for minimizing your risk. So let's delve deeper and examine the mechanisms by which this seemingly innocuous microbe can transform into a deadly pathogen. Flesh eating describes the rapid, severe tissue destruction caused by Vibrio vulnificus. When it enters through a wound, the bacteria release toxins that break down skin and connective tissue, what doctors call necrotizing fasciitis. The infection spreads fast, causing intense pain, blistering, and skin discoloration. If the bacteria reach the bloodstream, they can trigger sepsis, leading to organ failure and even death within 24 to 48 hours. Immediate medical attention is critical. Delays can mean amputation or worse. Not every infection becomes flesh-eating, but those with chronic illnesses, especially liver disease, are at greatest risk for severe outcomes. Quick recognition and treatment save lives. Climate change is fueling the rise in Vibrio vulnificus infections. Warmer oceans mean longer seasons and higher concentrations of bacteria in coastal waters. Hurricanes and flooding stir up bacteria-laden sediments, pushing contaminated water into communities. After storms like Hurricane Ian, Florida saw dramatic spikes in cases. The bacteria's range is expanding northward, now reaching places like the Chesapeake Bay and even New Jersey. More people in more places are at risk as the climate warms. This is a real-time example of how environmental change impacts public health. Adapting our strategies is essential. Vibrio vulnificus infects in two main ways: through open wounds in contaminated water or by eating raw shellfish. Even a small cut, fresh tattoo, or insect bite can be an entry point if exposed to warm, brackish water. Oysters are the biggest food risk. They filter and concentrate the bacteria. Eating raw or undercooked oysters can lead to severe illness, especially for those with weakened immune systems. The highest risk people with chronic liver disease, diabetes, cancer, or immune suppression. For these groups, even minor exposures can be life-threatening. Healthy people with no wounds have low risk, but everyone should be cautious. Know your health status and avoid risky activities if you're vulnerable. Prevention starts with understanding your personal risk. Make informed choices to stay safe. Vibrio vulnificus hotspots have long included the Gulf Coast, Florida, Louisiana, Texas, Mississippi, and Alabama. Florida's Gulf Coast reports the most cases, but warming waters are pushing the bacteria north. States like North Carolina, Virginia, and even New Jersey now see summer outbreaks. Brackish waters, estuaries, bays, and river mouths are highest risk, especially after heavy rain or hurricanes. Flooded areas can become unexpected danger zones. Check local advisories before swimming or harvesting seafood. Awareness of your location and conditions is key. Geography matters. Know the hotspots to protect yourself. Early recognition of Vibrio vulnificus infection is vital. Wound infections start with severe pain, redness, swelling, and sometimes blisters. Eating contaminated seafood causes diarrhea, vomiting, and cramps, often within 24 hours. For those with underlying health issues, the bacteria can quickly enter the bloodstream, causing sepsis fever, chills, low blood pressure, and blistering skin. If you notice these symptoms after water exposure or eating raw shellfish, seek emergency care immediately. Tell doctors about your recent activities. This speeds up diagnosis and treatment. Treatment is aggressive intravenous antibiotics, and for wound infections, urgent surgery to remove dead tissue. In severe cases, amputation may be necessary to save a life. Intensive care may be required for sepsis. Fast action is the difference between recovery and tragedy. Don't wait. Get help at the first sign of trouble. Heading to the beach is a fantastic way to relax and enjoy the outdoors, but it's important to be aware of potential health risks. Fortunately, you can dramatically reduce your risk of encountering these issues. By taking a few simple steps and being mindful of your surroundings, you can ensure a safer and more enjoyable experience for yourself and your loved ones. Being prepared is key. One crucial precaution is to stay out of salt and brackish water if possible. These environments can harbor bacteria. Avoid entering the water if you have any open wounds, scrapes, or fresh tattoos, as these can serve as entry points for harmful microorganisms. It's better to be safe than sorry. Even a minor cut can become problematic, so if you get a cut at the beach, it's important to act quickly. Your first step should be to immediately leave the water to prevent further exposure. Next, thoroughly clean the wound with soap and clean water, or an antiseptic wipe if available. After cleaning, protect the area by covering it with a waterproof bandage to keep out bacteria and debris. It's crucial to carefully watch wounds for any signs of infection in the days following the injury. Be alert for symptoms like redness, swelling, increased pain, or pus. If any of these symptoms appear, don't hesitate to see a doctor for proper evaluation and treatment. Protect your feet by wearing water shoes to avoid cuts and scrapes from sharp shells or rocks that may be hidden beneath the sand or in the water. When eating seafood, especially shellfish, it's essential to take precautions to prevent foodborne illness. Always cook shellfish thoroughly to kill any harmful bacteria or viruses that may be present. Keep in mind that raw oysters pose the biggest risk of transmitting infections. Individuals with weakened immune systems are particularly vulnerable, so if you have a weakened immune system, extra caution is needed. For those with compromised immunity, it's best to never eat raw or undercooked shellfish to avoid serious health complications. When cooking oysters, ensure they are cooked until their shells open, indicating they are properly heated. If you're frying or boiling shucked oysters, make sure to cook them for at least 3 minutes to eliminate any potential pathogens. In the kitchen, it's crucial to prevent cross-contamination to avoid spreading bacteria from raw seafood to other foods. Always keep raw seafood separate from cooked foods and other ingredients to prevent contamination. Remember to wash your hands thoroughly with soap and water and clean all kitchen surfaces well after handling raw seafood. By following these simple habits, you can enjoy the beach and delicious seafood safely, without compromising your health. Remember, prevention is always your best defense against potential health hazards at the beach and in the kitchen. Flesh-eating bacteria headlines are scary, but knowledge is your best protection. The risk for healthy people is low. Most infections happen under specific conditions. By following expert advice, you can manage your risk and enjoy the coast with confidence. As climate change expands the threat, public awareness and education are more important than ever. Stay informed, share accurate information, and support public health efforts. Pack a first aid kit, check on loved ones' health, and choose cooked seafood. Small, smart actions make a big difference. Respect the ocean, but don't fear it. With vigilance and knowledge, you can stay safe and enjoy all the coast has to offer.